Well, it has been a really difficult time throughout the world and even here in Southern Nevada as we see a rise in COVID-19 cases due to the holidays and also the Omicron variant. A lot of people want to test at home and have questions about how often they should be testing versus a PCR test. So we wanted to clarify some of those answers for you. I'm joined by Dr. Cassius Lockett, Director of Disease Surveillance and Control with the Southern Nevada Health District. Dr. Lockett, thank you so much for being here.
Thank you for having me.
So let's start with a question a lot of us have. Right now we're in the midst of cold season, flu season, there's allergies. So how do you know if it's a cold versus COVID, and when should you test?
Right now, during the winter months, it actually presents us with a mix of both flu and COVID viruses and other respiratory diseases actually all circulating at the same time right now. And that coupled with the fact that all of us, due to the cold weather, we're almost likely also going indoors, right? So it doesn't help that both flu and COVID are able to survive better in cold temperatures and in lower humidity. That just doesn't help us. But regardless, we're also seeing at the same time, we have to be vigilant and stay vigilant with our public health mitigation measures we've been practicing. And that's because right now, something that we call and monitor called influenza-like illness, it's high in our state. A couple of weeks ago, it was very low. And so what that means is the flu has finally come out and it's starting to rear its head and surface and impact and affect more of our residents. And so symptoms can look just like you can have the sniffles, or maybe you're feeling tired or you're coughing or something like that. Both COVID and cold symptoms are similar that way. Second, we know that COVID cases, as you mentioned, are very high, higher actually than ever before. And that's due to the infectious nature of the Omicron variant, which produces symptoms that kind of overlap, like we just talked about. The symptoms are actually milder. People are having sniffles. Some people are getting fever and headaches and body aches as well. So I would say to look out for those, but symptoms that are common to COVID specifically and less common to cold is if you have a fever or if you have a headache, if you have extreme exhaustion, especially pay attention to that one. Extreme exhaustion has been associated with the Omicron variant. If you have that, that's important to really, just make the distinction that you probably have COVID and less likely have flu. And the classic one, which we're not seeing during Omicron that much, but Delta's still out there, and that is loss of taste and smell. And so I would say if you have at least one of these, fever, headache, extreme exhaustion, loss of taste and smell, get tested right away. And it doesn't matter, this is an important thing too, it doesn't matter what your vaccination status is. Get tested if you have at least one of those. And especially amongst vaccinated people and people who have been boosted, we're starting to see really a lot of people with the sniffles, like head congestion, body aches, really mild symptoms. And so you may only have one. You may just have a little congestion. You may feel a scratchy throat. And you say, hey, I've been vaccinated and boosted. Go get tested right away.
You know, people would hear you say, go get tested, and it is the right thing to do. It's so hard, though, it's not the easiest thing, I guess I should say, to go out and get tested. As we've seen, there are long lines. Appointments are filling up very quickly. People are trying to get these at-home rapid tests, which are nowhere to be found really anymore right now, or far and few between. So how heavily should people rely on these at-home rapid tests, and how often should they retest with a rapid test if they actually get their hands on one?
These tests are really good at detecting the virus. If you have, an adequate viral load in your body, it's really good at detecting those. So these tests, and this is the key thing here, these tests are most reliable. Since we're talking about reliability here, they're most reliable if you have symptoms of COVID, like we talked about, fever, headache, stuffy nose, maybe you got a scratchy throat and cough, but they're most reliable when you have symptoms. And so with that said, home tests detect the virus in high enough amounts to the fact that if you do test positive with a home test, you're most likely to be also infectious. So keep that in mind. You're also infectious with that. And under these conditions, my suggestion is you really don't need to go out and wait in a long line. If you're able to get your hands on one of those tests, you don't need to make appointments. You don't need to follow up what they call a PCR test. If you are negative um, and you have symptoms, because we have to look at that scenario too, then I would recommend that you do follow up with a PCR test, because that doesn't mean that you're necessarily free of the virus. And that's the problem with you having symptoms and then having a negative test. The probability of you having the virus is still unknown. You could definitely still have the virus. And so at that point, I would recommend, unfortunately, trying to get an appointment and standing in those long lines that are developing, if you can get an appointment, and taking the PCR tests. And the PCR tests are primarily used in healthcare settings. It's primarily used in public health settings, like the ones, test appointments you can find on our SNHD testing website. These tests are a lot more sensitive. And what they do is they take the genetic material of the virus and they make copies of the virus from very, very tiny amounts. So that's a really good test at doing that. It's a really good diagnostic test. However, to get your results could take between 1 to 3 days. So it's not as quick as a home test, which is like 15, 20 minutes. You know what's going on. You can isolate, or quarantine. This, it takes 1 to 3 days. So you have to plan accordingly if you're going to do a PCR test. Guys, we're still waiting with our state partners to find out more about the 500 million test kits promised to states and local health departments, courtesy of the Biden administration. We don't have an anticipated arrival date at this point in time. Meanwhile, we are developing a home test kit plan right now to get those out to our partners as soon as we get them. That plan is being developed right now as we speak. And we're exploring ways of getting a hold of a limited supply of some of these home kits from other manufacturers as well. And I think other states are following that suit and following that lead to try and see what we can get. But it doesn't look good. It looks like some of these tests may not be available for a couple of months.
It's tricky because when you take an at-home rapid test and you test negative, but you still maybe you feel congested in your head, or you just feel tired maybe from a cold. A lot of people would maybe play that off and say, no, you know what, it must just be a cold. I'm still gonna go out into the world. The at-home rapid test, the home test said I was negative, so I'm good. This is just a cold. How do you deal with that with the Southern Nevada Health District? Because there are a lot of people who are trying to do the right thing, but don't necessarily understand how the home test works and how you have to keep testing, or how maybe you should get a PCR test in case.
It's going to be really about whether or not if you have symptoms. I want to make that clear. So the most important thing to do, and this may even help with the traffic, if you have symptoms, the most important thing to do is try to schedule one of these appointments. We know they're filling up quickly. As soon as we put them out there, they fill up now. There's so much testing demand out there. But that's the most important thing you can do. Check our website regularly too, because it does refresh often, and you may be able to successfully get an appointment if you have symptoms. Would highly encourage you to make an appointment. And we've been having a lot of no-shows and cancellations, and so that hurts people who really need to get tested. So I would encourage you, if you actually make an appointment, stick to that appointment. It helps the whole system stay together. But regardless, there are long lines, as you pointed out. Appointments are hard to book, as you pointed out. We acknowledge that. And home testing supply chain is low. We acknowledge all three of those things are true. So if you cannot get tested, the best thing to do is to stay at home if you have symptoms for at least, following the CDC guidelines, at least 5 days, right? And if you're fever free and your symptoms are resolving at that time, well, guess what? You put on a well-fitting mask and you can go around others for another 5 days. And as long as you go out into society carefully that way, that's perfectly fine. However, I would recommend still getting a rapid test or PCR diagnostic test if possible during that time. if you can squeeze it in. So I still wouldn't give up on the appointments, especially if you have symptoms. I think that's important to do. If you have no symptoms, again, or fever around others, and you've been exposed to someone, same thing. I recommend you can't get tested. You've been told you're exposed. Stay home for 5 days if you can, and wear a well-fitted mask around others after 5 days when you go back out into society, and watch for fever.
I have two more questions for you. One of them is kind of a tricky one because when you're talking about the home test, is there a magic number of days into the symptoms that you should take an at-home test?
For a rapid test, it's really good if you take that test 1 to 5 days after symptoms start. That's the really good window. After 6 days, the test may not be so good because it detects the level of virus particles present in you. And so it's most accurate 1 to 5 days after the symptoms start. In terms of PCR tests that pick up that genetic material we're talking about, the PCR test is going to take you should probably take a PCR 3 to 5 days after you've been exposed. And if you have symptoms, which means you have a high viral load in your body, you should take it immediately if you have symptoms. And PCR tests are so sensitive, they can detect the genetic material in your body weeks and even months after you've been infected.
And even right after exposure as well. So if I've been unknowingly exposed to someone, and today, and I happen to take a test out of caution 3 to 4 days later from now, the PCR would be able to detect it?
The PCR will be best to pick it up 3 to 5 days after. What the mistake some people make is they get exposed, right, and they become a high risk contact to a real case, which means you spent 15 minutes of accumulated time with that infected person in a 24-hour period. That's what that high contact is. And so if you are a high risk contact, then what you should do definitely is you should get tested 3 to 5 days after you've been exposed. Some people will test immediately the day after, and they go do a PCR test and it comes back negative. And that's because there's not enough virus or genetic material yet to be picked up by a PCR if you do it too soon.
Well, Dr. Lockett, thank you so much for your time. A lot of great information you gave us today. Thank you so much.
Thank you. Thanks for having me.